Today's the 13th.
Yep.
Hey, Dr. Malone, this is Joe Zarzaur, again with our COVID update. Today's the 13th of April. We went a whole weekend. I saw something about the social distancing score over the weekend. I can't remember which way it went, but they were talking about it in the news. Which way did it go?
It went down in grade. So
Oh, no.
for late last week, I said we were like B and C range, and I think D for the last 3 days that it's been.
Weekends are not good for us.
No.
Yeah,
And
we
so
don't
that's East Canby County grade D.
Well, what's happened? What happened to our numbers, infection rates over the weekend?
Okay, so when we were last year on Friday, as a county, we had 204 cases that were positive. And then over the course of the weekend, I checked it every day, it was up to 210, Saturday, 224 yesterday, Sunday, Easter Sunday, and now 241 today. So continuing to go up for the overall cases. And then the developing news, I guess, was the revisiting of the protocol as far as releasing the long-term care center data. So again, a week ago we had, and it went to 8, and then over the course of last week there was some back and forth about whether or not it should be released. And as of about an hour ago, we're at 39.
Well, that's not good.
So, no.
Do we know what facility is doing what yet? Still no. And so they haven't told the families. Still haven't told the families where this stuff is coming from, what facilities are involved, all that kind of stuff.
I think from what I understand, the families were notified, but the public has not. The public has not been, and all questions have been referred to the state surgeon general, and that includes the heads of the local emergency system with Escambia County. So they're basically deferring to state level protocol there. So, and I guess even today on the mayor's press conference, he had said that he thought it'd be useful and valuable information to release that, and kind of gave some cryptic guidance that, you could probably figure it out if you studied this long enough, as far as where the zip code changes were happening over the last so many days. But I tried to do that, and it's really not that clear because there's so many different facilities, and then whether or not they're in city or not. So it's not as straightforward as you think, but nonetheless, going from 1 to 8 up to 39 over the course of a week with any kind of relationship to centers is disconcerting. I will say that a week ago when we first talked about it, and you said, oh, well, is there another one at all? And at the time, we only had the Seattle incident. And then 2 days after we had an initial talk is when the Richmond, Virginia episode came up. And now it's happening at many other locales across the country.
All right. Okay. Any other significant things that happened over the weekend that we need to talk about before we talk about today?
Not really a whole lot there, unless you want to say, all these different thresholds that people pay attention to, the state of Florida is at 499 deaths, so about to cross 500, things like that, but no other major developments locally other than some of the back and forth as far as how some of these county level reports are going to be coming out, which doesn't really change a whole lot of the story other than knowing the story. And I commend the local news. I can get news alerts pretty frequently, so
that's good. All right. What else do we have today for us?
So I guess Joe's kind of charged me with trying to pay attention to some of the items that aren't necessarily in the mainstream, things that would be useful and or interesting or help educate us as far as not only this disease, but its impact on communities and the health system. And so if I were to ask you, Joe, what do you think is going on as far as the heart attacks in the country, given all this stress on people and their lives and all this change? Do you think that there's more people showing up to hospitals with heart attacks or less?
I think people are dying in their houses, right? Because they're scared to go to they have chest pain, they stay home instead of going to the COVID facility because they're worried they're going to get COVID.
Yeah, so, and here you go. And this is what they call a pre-proof, which means that it's the Journal of American Cardiology, and they have released this prematurely, knowing that there is useful information to get out there. And I will show you the snippet. This is what they're saying, the short tweet: 38% reduction in STEMI activation in the US during the early days of the pandemic. 38% reduction is a very significant reduction, meaning
is that
people are not
diagnosed STEMIs, or I don't know what does that mean?
So what they did is they took 7 facilities, and I'll list them right here. And so these are high volume facilities that do a lot of, and a STEMI, just for those who are tuning in, that's the big bad heart attack that when you're in the back of an ambulance and you're heading to the hospital, the STEMI alert is mobilized, and you don't spend a whole lot of time between when you get to the ER and when you're on a cath lab table with meeting your cardiologist for the first time, and having a stent put in, hopefully to alleviate you of your acute myocardial infarction. This is different than a non-STEMI, where you don't necessarily race to the cath lab. You may end up with a cath, but these are the big bad heart attacks that people, if they're going to have a bad outcome, usually what it's from. So anyhow, they had all these facilities that they pooled their data, and they pooled it from a year prior, basically, and then they compared it to what's going on now. And they're basically saying they called it after COVID and before COVID, AC and BC. So kind of like BC and AD. But anyhow, right. So this is what you're looking at. The preliminary analysis during the early phase is a 38% reduction in cath lab activations. That doesn't mean that the diagnoses aren't there, and that's the scary part. And they had theorized before all this that they actually would see more STEMIs coming in because people are having chest pain at home because of stress. Like, this is a big life-changing event for them. So they would thought there's gonna be more middle-aged men showing up with heart attacks because, you know, they're having trouble making ends meet, and there's a lot of stress in the home, things like that. And as well, viral illness can cause pericarditis, which can mimic a heart attack a lot of times when someone first shows up as far as their symptoms. So when they show up, if they're saying I have crushing chest pain, they're having a heart attack until you prove otherwise. So they thought we're gonna have more STEMI alerts, and they had the opposite, in fact. And they think that one of the reasons for this is because people are avoiding medical care because they don't want to go to the hospital and get COVID, and that's scary. That's scary.
Well, the same thing is happening with the few car wrecks that are happening. The same things are happening with my clients. They're involved in a wreck. They know they need to go to the ER. They don't want to go to the ER because of the COVID thing. And I had one lady today that was in a wreck and had to go back to the ER a second time, and because she's pregnant, and the OBGYN said that the ER didn't check the pregnancy well enough after the wreck. And so she went back to the ER a second time, and she said that it caused her even more stress to have to go back to the ER twice in one day, much less once. It was stressful enough to go one time. So in any event, that is something I'm also hearing from clients of the firm, not wanting to go to the ERs. So that doesn't surprise me. In fact, that sounds exactly like what I thought you were going to say.
Yeah, and so the idea is that they're going to continue with this study because, you know, you can, in theory, survive a heart attack without any treatment, but how long do you survive, and when do you start developing complications because your heart muscle's been weakened, things like that. So this is early on, and so it's not a good sign. And I guess in my own experience, this is back in the days of like pediatrics rotations in medical school. If you're on pediatrics rotation in the month of February during the Super Bowl, no joke, Sunday night, Super Bowl Sunday, the pediatric ER is completely empty. And then an hour after the game is over, everybody shows up. And I mean, it's a little bit of a joke. Like, we laugh about it because, oh, these parents are like, oh, you know, little Timmy can, you know, suck it up until after the game. Well, the scary thing here is that those kids are dependent upon their parents to get to that ER. Now these people are just dependent upon themselves calling or not, and they're not calling. So I guess it's letting these people know that, you know, you need to be treated for your heart attack, whether or not COVID's out there. So seek medical attention, and, you know, for the things you
look, the hospitals are organized.
Car accidents.
they're organized enough anyway. That's what I'm telling my clients. Look, they're not going to have COVID people sitting around non-COVID people. You're probably safer right now to go to the ER than you are at any other time, because now they're paying so much close attention to how communicable this disease is. They're probably doing more cleanliness wise in the ER waiting area than they would have done any other time. So you might even be safer to go now than any other time. You were going to say something? Go ahead.
Well, and if you remember back with like the H1N1, or back when some of these other viruses are around, you know, all these ER people didn't avoid going to them. Like when you walk in, they ask you if you had recent fever, if you had recent travel history, things that, you know, are you an Ebola risk? So these hospitals are used to doing that, and they're doing it now. They're doing it on overdrive. So they're not going to put you in the room that's not been cleaned. They're not going to put you in the room with, with someone that's got a fever and you're there with crushing chest pain. And in fact, if you're crushing chest pain, alert, you're not spending a whole lot of time in the ER anyhow.
That's right.
You're going right to the cat. You're going right to the cath lab. Yeah.
So I, you know, this is our 5th week of being remote at the office. You know, you and I haven't been in the same room or office together this will be the 5th week. Isn't it safe to say that nobody on our staff, we thought some people had it initially because we were panicking, I think, the first couple of weeks, but they didn't. We had 3 or 4 people test and they all tested negative. We've been all, and I'm speaking as a community and I guess as a nation, but everybody's been very good about social distancing for the most part. Is it safe to say that if you haven't gotten it yet, that you're not going to get it on this wave, that you may get it on the next wave, but since it seems to be coming down, is it safe to say that people are not likely to get it now, but they may get it on the second wave? Like if everybody comes out at the same time and it starts spreading like wildfire again, one person can make it spread like wildfire again, you could potentially get it again from that one person. But it seems like, for the most part, we're on the backside of this here. Do you think we've already peaked or not?
I think we're close here, especially if you look at some of the state and county numbers. We're starting to flatten out on the new diagnoses every day. So there's still going to be new diagnoses, but there's going to be fewer of them. And you like to think that across the population, your chance of being one of those fewer people, you know, goes down each day. And then also, when we go back to being in the office, things like that, it's going to be a different kind of experience. So, are you going to shake my hand? Or we're going to be wiping on the surfaces, things like that. So that, coupled with the population dynamic of the illness, I think in our behavior is going to make your chances of getting it on this wave a whole lot less. And then when we hear that there's another wave coming, when and if that happens, because I think we're going to have season, just like we have flu season, we're going to have COVID season. It's going to happen again, but we're going to be prepared. You know, it's going to be okay. Here comes COVID season. Start wiping down everything with these bleach wipes and start, all the precautions you would normally take during flu season, you're going to be taking for flu and COVID season, or cough, flu, and COVID season. That's what it's going to be. So I think your chance of getting it is going to be less over time. Will it be like that next week? Probably not that soon, but over the next month or two, yeah.
All right. So what else do you have today? Any other tidbits?
Oh yeah, as always. So we just mentioned the flu season, and so the CDC is actually slowing things down on their influenza surveillance reports, and they're actually shifting their focus over to the COVID stuff. And that's not to say that flu isn't, well, the focus that they had on flu is going to be put solely on COVID. But if you look at this top of this website, and we'll link it at the very top in the gray box, it says note that, put all of this data with some caution because COVID scenario, which it's not been before. So I guess that's their way of kind of saying the numbers are there and they may not be as accurate as we would think. But down to the bottom here, this is the interesting part. CDC estimates that so far this flu season, there's been 39 million flu illnesses, 400,000 hospitalizations, and 24,000 deaths. Well, right now as a country, we're at 23,200 COVID deaths.
Wow.
So flu was there long, but they're saying that the next thing down, that all the antivirals worked, the vaccines covered well this season, and with that, that's where we landed. So now transpose this with COVID, and fast forward a year or 2 years from now, I think we're gonna have COVID season and influenza season, and you're gonna see potentially 2 sets of numbers instead of 1 set of numbers, and they may both be like. So, you know, this caught my eye today because the number of deaths from the flu is pretty much where we're at with COVID as a country right now, and flu season is more or less winding down. And in fact, they're saying that for the state of Florida, it's basically a very limited flu diagnoses going on right now. Was there, and it was there all along. You just didn't hear about it for the last 2 months because the thing else was stealing the headlines. So,
all right,
I have that.
What else?
And then so lastly, and there's this is the kind of stuff that you think about when you're watching sci-fi movies, or you're watching all these different kind of like black helicopter kind of conspiracy theory movies. Well, it's out there, and it's a real proposition, and it's some proposals for some studies on if you can use digital contact tracing to notify you. So there's going to be an app for that, to use the old cliche. And the idea is that the communication can get out sooner and more frequently in a manner that people are used to receiving updates, to say, hey, like, this now is the time. This is season. Now's the time to start wiping stuff down. Now's the time to start instituting some of these measures, and give people some of these alerts. Same time, there's mentions, and I linked paper in here today. There's mentions in there of basically enabling your Bluetooth, so that if I'm walking down an aisle in a store, and you're walking down an aisle in a store, and I've had COVID diagnosis recently, you're going to get pinged to that
Wow.
Joe Zarzaur is Joe Zarzaur is within so many meters of someone who had recent COVID, and you're going to be like, probably drop your stuff and run out of the store. But that's kind of where they're talking about, and there's a lot of ethical and human rights and things like that considerations. So it's an interesting read, and the people that are proposing this are not like on the all hands on deck, like, yep, we just need to do this and take all your rights away. They're looking to what's the best way to strike the balance so that they can benefit all of humankind, and tool without invading your privacy.
I think it would need to say not within so many feet, but within a larger expanse of space. That way you can't narrow it down to who it might be.
Yeah, but the idea is that it's going to trace where you were, and then so even like if I was at the grocery store and a day later I tested positive, and it's going to tell you that you were at the grocery store yesterday with someone who tested positive who was also there, and you're going to be like, oh, okay. So it's going to do that tracing in real time, so that it's not reliant upon some overburdened or overworked medical personnel that are busy sticking swabs in people's noses instead of doing the contact tracing. So it's gonna be automated almost. But then how do you enforce who has that app on their phone, or that whatever software as part of their life? So that there's a whole lot of considerations, but the ball is rolling on this, and people are starting to consider how can we get this information out to beat this fast moving pandemic.
I would enjoy the opportunity to have an app that allows you to test at home whether you have the virus somehow.
Yeah.
I don't know if they're working on something like that.
Well, and this reminded me, like last week, you had mentioned, I guess, in a little bit lighthearted manner, but you said, listen, before someone comes in the office, I want to be able to test them to see if they're alive. You could have this app and say, according to the app, have you been around anybody who's tested positive, in the past 3 days, kind of thing? And that'd be as close thing to a test as possible. Say, okay, work from home today, that kind of stuff.
Right.
So
work from home for 2 weeks if you test positive.
Yeah. Exactly. Well, and the idea is that once you got that notice as an individual, then the onus is on you to say, okay, now I need to listen to this, and I need to isolate. I need to change my lifestyle until I prove that I don't have it, or whatever the case may be. So, it's very early in this, but the people are out there thinking this way. So,
well,
that's what
I
I
don't
had for
think it's
interesting
necessarily
stuff.
a bad thing. Well, I appreciate it. I'm starting to feel just anecdotally better about the situation. I don't know why. I don't have any data to back that up with. But other than the data that they keep putting out from New York City and the bigger cities that show that they're way down on the curve. I think the number of ICU admissions was like negative. And, I feel like we are on the other side of this too here, because it doesn't seem like our numbers are climbing rapidly. They're not really decreasing here yet substantially either. So I don't know, what's the rate now? Is there a testing rate number?
The percentage.
Yeah.
The percent that we're as a county, we're at 6.5%. But what I was going to do is, as far as like the amount of tests that are done, that's 6.5% are coming back as being positive. So initially it started real high, like it was like 10, 12%.
Yeah. Mm-hmm.
Yeah, it started up real high, and that's not to say. I think at that point it was, it's the way you get these people screened to get to the point of getting tested. So there was such an onslaught, and I had to think that at a certain point it's like, yeah, we want to test more people so we catch it, and now it's like more scrupulous as far as if you don't have the direct contacts, or if your symptoms don't match up, or hey, yeah, we do know this is allergy, so you don't need to be tested. So I think that some of the pre-test probability was a little bit more dialed in as this went on, as the personnel got used to doing it. I was gonna try to, I can't get it pulled up, but what I'll do is tomorrow I'll pull up the county dashboard. It's a little bit more of a complex link to share, but it has what you're talking about, some of the flattening out. So there's still little peaks and valleys, but the overall trend, if I was going to map this thing out, goes like this. Starting to do that, a little bit of a plateau and downward as far as the number per new cases per day, which I like that. And I think that kind of puts us toward, maybe we're going to fall in that geography of closer to the Mississippis and Alabamas and Louisiana as far as when they're going to peak, which hopefully in the next week. And right now, the rest of the state of Florida is calling for first week of May. So I'd like to fall in. I'd like to fall in that earlier group.
Right. All right. Well, we'll see you back tomorrow. The office is running full steam. We had several new clients that came in today, and we were able to sign them up. If you're involved in a wreck or some other personal injury case and you need a consultation, you can get us on the web at zarzaurlaw.com or call us old-fashioned at 855-HIRE-JOE. If you have questions about what we put on tonight on this video, you can comment underneath here, or you can email us at info@zarzaurlaw.com. Thank you, Dr. Malone. We'll see you tomorrow. Stay healthy.
All right. See y'all.
Bye.